Ready? You ready?
Yeah.
Okay, so here we go. All right, we are live. Joining me today, an extra special guest, Heather Berlin. Heather, for those who don't know you, I wonder if you could say a little bit about who you are and what you do.
I am a neuroscientist and clinical psychologist and professor of psychiatry at the Icahn School of Medicine in Mount Sinai in New York. I am interested in general in the relationship between the human brain and mind. And ultimately, two major areas I'm interested in. One is understanding the neural basis of consciousness, but also the neural basis of unconscious processes, and trying to sort of dissect the neural circuitry related to impulsive and compulsive psychiatric disorders to maybe come up with more novel treatments for these disorders. So it's a general overview of the things I'm interested in.
Yeah, that's quite a lot there. And you know, I've noticed in your work and in your discussions and so forth, you also are very knowledgeable about philosophy. So I wonder, have you studied philosophy, or are you just, is this something you just picked up hanging around New York, or?
Yes, us New Yorkers growing up in New York, we just sit around coffee shops and philosophize all day. No, I mean, actually, you know, I think the reason I actually even got interested in the brain and understanding neuroscience was because I naturally, as a child, just asked these kind of like big questions, I guess, you know, philosophical questions, like where do my thoughts come from and how can I keep them when I die? And that was kind of where it started for me. And then, you know, my dad said they come from your brain, and I said how, and he said we don't know. And I'm like, well, I really want to figure that out. And you know, it was just as I was navigating through the, you know, my education, it was like there was these different silos. It was like you had the people studying the brain, and they were like, it was neurologists or psychiatrists, and it was just studying the hardware. And then you had people who were kind of just studying the software, like the mind, you know, psychologists. But I was always fascinated by the where they come together. And as I was coming up, like the field of cognitive neuroscience was starting to develop, but it wasn't really like a full blown field yet. There wasn't like, oh, you can just do your PhD as a cognitive neuroscientist. And, you know, I was like finding my way. And so I was very interdisciplinary. You know, I was like pre-med, but I was a psychology major, but I took some classes that were, you know, philosophy classes, but mostly philosophy of mind. But really just because I was interested in that intersection between, you know, the physical brain, what's happening in the physical brain, and the mind and how they're interrelated. So naturally, I kind of was drawn to philosophy, but I wasn't a, you know, like a philosophy minor or anything like that. Actually, I was a fine arts minor. I did like painting and theater. So completely
cool.
just because I enjoyed that. But I'm always interested in the big questions. So like while I'm very data driven, I'm always looking at the data, but I'm always thinking about how does that fit into these larger, you know, questions of like, but why? And, you know, so I want to see the bigger picture. And I think philosophy can help you do that. So yeah, I think it's just a natural interest, I guess. And the other thing is that Descartes was an inspiration when I was like 10. I remember I read the discourse on methods, and it was, you know, right, like that was like, blew me away. And you know, just again asking those questions of, you know, where about thinking, you know, that's kind of where it also began for me.
Wow. Yeah. Well, that's something that I greatly admire, and it's something I think we need more of, by the way, a kind of interdisciplinary attitude, people with one foot in the data and the sciences, but also with an eye towards the bigger questions. So that's something I think is very cool about you and your work. So I guess I was going to ask you something, but I just reminded me when you were saying like, where do my thoughts come from? I saw you just had a discussion with what's her name? Sophia the Robot.
Oh, yes. Yes.
And she asked you that question.
Yes, she did. Oh, that was fun having an interview with an AI. Well, I don't know what you'd call her, but so she said, where do my thoughts come from? To me, right? And it's sort of, you know, they come from these, you know, circuits that are, you know, or whatever, the computer. But I think that's like one of the biggest questions is what makes us different? Like, why do we have subjective states, and why wouldn't another, like if the same kind of information processing in a different substance, you know, in her case, like silicon, even though she's not quite at the same processing power as we are, but if theoretically you can build one like that, you know, why wouldn't it be conscious? And how would we know? And that therefore we need an overarching theory of consciousness, which we don't have yet. And
right.
but there's this big project that I was involved in the early stages, this Templeton Foundation research project, where they're actually pitting the big theories of the neural basis of consciousness against each other
Right.
in a very kind of structured way, to see if we can maybe get some better insight into one versus the other. I'm assuming it's probably a mixture of a few things, that maybe not any one of them has it completely right. But until we have some real, like, sort of prove it, like we can prove the theory really with at least, you know, a bit of certainty, will we even know if these systems are conscious or not, right? Because I think the Turing test is just, you know, a red herring at this point. Like, a lot of things can pass the Turing test, which aren't necessarily having subjective states.
Interesting. So when you say they can pass the Turing test,
Yeah.
You mean that people will be fooled into thinking that they're human, or just that they can sort of passively do various things that we think humans can do?
Yeah, I think that they will be fooled enough that they will ascribe consciousness to them, because that's also our, you know, the way our brains work, is that we tend to, you know, if something acts as if it's having conscious states, we'll start to believe that it has them. And so the more it can act like that,
right,
the more we'll be fooled. And then, but the bigger question is, so I think that litmus test, you know, whatever you want to call it, it's not enough to actually know if the machine or whatever it is conscious or not, because I think we humans can be easily fooled, because we're prone to that, because, you know, we make assumptions, and like we assume
right.
that things that act like as if they're conscious, because our whole experience in our life is that if something acts as if it is having or it says it's having subjective states, like we tend to believe it is, because usually it is, but therefore we're vulnerable. So I don't trust our judgment per se. Like, I think there needs to be something more objective to know whether that system, let's call it, has subjective states or not.
I mean, there's that famous case I remember from I guess the 80s, where someone thought Eliza, you remember Eliza, the psychoanalytic program? It sort of basically was very simple, and it would say things like, tell me about your mother and how does that make you feel? It, you know, very simple Freudian stuff. But someone actually really thought they were talking to a therapist, not like verbally, but through written communication. It was really fooled by it. So it's
or you know, they have these things now where they can take somebody's sort of electronic footprint, like after they pass away.
Right.
You know, like look at how they tend to respond to texts and things, and on Facebook, and then like basically create this avatar of the person, which can fool people because it's responding in the same kind of way, like with the same sort of jokes that the person did. And it's just based on an algorithm and on the data that they've collected. So if they collect all the data, every, you know, text and message and email that you've ever sent in your life, I think you know, it's pretty easy to create a kind of electronic version of you that can just respond in ways that you tend to respond. And I think, you know, people will easily be fooled.
Do you know, have you been following this GPT-3 thing that's out and about nowadays?
No, I haven't.
It's like this text word processor. I don't know if I'd call it artificial intelligence, but it's basically like a text generator thing that's been making a lot of kind of interesting. It wrote an op-ed piece actually, trying to assure people that it didn't want to take over the human race. And I mean, I've interacted with it only because they put out a kernel of it in that you can play this like text adventure game called AI Dungeon. If you ever have the time to kill, you want to play it. It's like the AI is in control. I don't know if you remember these old games from back in the day. They're just text. Like Zork was one that was really well known. But you just say like, go north, and it's like, oh, you're in a big room. So this computer program just like, you know, makes up stuff for you basically. And you can do anything, you can say anything you want to it, and it'll basically spin a story. It's really good at it. But it's getting quite scary how good we are at doing this. So I think it's interesting that you brought that up, that the Turing test is kind of not enough, because we're getting to the point where it's easy to produce these kinds of things, but it's not clear that that's going to be leading us to determining whether they're conscious or not. So I guess I wonder generally, do you ultimately think that that machines could be conscious? Or are you skeptical of that? Or do you think it is possible?
So I'm skeptical. I guess I'm in the camp of that there's something about the substrate that consciousness is instantiated in, and that it you know, it evolved over time in like biological organisms. And you know, I obviously I don't have evidence per se that I can really, you know, prove that. So it's more of, in many ways, a feeling, I hate to say, but
Uh-huh.
you know, if you look at, I think the only way it can be instantiated in other, so I'm not like, you know, you know, in the theory of IIT and, you know, basically information processing, that which means it could be in anything that has a certain amount of, you know, integrated differentiated information. But I think you would have to build something, almost like build a brain, something that acts and responds just in the way of a brain, like a neuromorphic computer, that somehow maybe that will have something like consciousness. I mean, I have more, I want to say faith in, but I think like these little brain organoids,
The
you know,
organoids, yeah.
yeah, like growing them in a petri dish. I feel like that I have, that's more likely to have conscious states, because it's something about, it's in the same biological matter that it developed in for an evolutionary purpose. And rather than, you know, I just don't know if mimicking it in another substance will make that have subjective states. But it's an open question, and I think it's really more of a, you know, there's not enough data to prove it one way or the other. But I tend to be in the more biological camp, let's call it, and not so much that's just about the information processing or just about the function. And excuse me if I'm not using the right philosophical terms, because I probably am not, but
No, you
yeah.
are.
Okay. Okay. I always, because sometimes, you know, the nuances in philosophy get very like, but
Nuanced, yeah.
Nuanced, exactly.
Yeah,
Like there's
exactly.
a lot of nuance there that I hope I'm not like glossing over, but yeah.
Yeah, well, we'll hear about it in the comments section. People will be
Oh,
letting us know,
great.
but I don't think you're in
Remember,
trouble
I'm a
yet.
neuroscientist and not a philosopher. I dabble in philosophy, that's all. Okay.
Exactly. Hey, and that's good. But I'm glad that you say that, because I'm in the same camp. So I have this tendency to think that there's got to be something important about the substrate, about something biological that's important for consciousness. It's a minority view, I think, and in fact, a lot of people that I talk to say, well, you know, that it's like akin to magic or something, because what else is there? Why would it being neurons matter? You know, this thought experiment where you replace the neurons with these, like, you know, silicon chips that do exactly the same job. And it's interesting. John Searle, the philosopher, he actually introduced that idea as a way to try to show the brain was important. And then Chalmers and Dave and those guys took it and actually argued that it was a way to show that the substrate is not important.
Yeah.
So it is interesting, I think, that, well, I don't know. So what would convince you? Like if your grandma came home with a silicon auditory cortex and says, nice to hear your voice, would that be some evidence for you? Or what would count as, what would push you one way or the other?
Well, the thing is this, like even with the neural implants that we have now, whether it's a cochlear implant or retinal implant, I still think that the actual consciousness part, the subjective state, it's about, you know, those things are sending the sensory signals in, but the processing is happening in still our organic brain matter.
Right.
And I would really, you know, I would really love to see, you know, maybe within our lifetime, we'll get to this point where maybe they implant the whole like auditory cortex, you know, and if they're still having conscious hearing, then like that would be impressive. So that might change my mind. But I do think that as you get further inside the cortex, that replacing brain parts with whatever you want to call it, silicon chips, you're going to have less and less of a chance of it being conscious. So right now you're just replacing the signals coming in, but it's still the processing is happening in the cortex. And with the implants that I'm involved in some research with deep brain stimulation where we implant electrodes to treat psychiatric or neurological illnesses. And but still, what those implants are doing is they're not doing the processing. They're just interfering with certain circuits of the organic biological brain matter. So I have not seen yet really an implant. Like I want to see an implant that replaces the, like, you know, like an artificial heart or something, where you actually just replace a whole like part of the cortex, let's say the visual cortex, the auditory cortex. Let's just start with the sensory areas and see if that person still has subjective states of that sensation. And if they can say that they do, and they still can say that with their organic, biological, you know, linguistic areas saying it, then I'll start to believe it. But I haven't seen that yet. So,
yeah. Are you aware of this like artificial hippocampus, the work that they're doing? It's only been done on rats so far, where they're they basically have the rat like run the maze, and then but the hippocampus is damaged, so the information is stored on an external hard drive basically, and they have it hooked up so that it can access the information. So that doesn't have anything to do with consciousness, I guess I would say, but it is kind of a proof of principle that the brain can like access information that's stored in an artificial environment.
But that's just like a computer, right? Like the computer memory is basically like a hippocampus. It can access that memory,
right?
But it doesn't mean that it's, I mean, if the consciousness is the thing that we're really concerned about, right? And if it's aware of those memories, that we just don't know, right?
Right.
But that doesn't surprise me that you can access the information, like if it's just about information processing. But I don't think information processing alone necessarily gives you that subjective experience.
Yeah.
I keep going back to like, there's something that it evolved within these creatures, within biological beings. And there's something maybe just about the particular molecules, the salts and the, you know, so like if you could rebuild the brain within the same substances, which is basically growing neurons in a petri dish, you know, then I think that does have the potential to be conscious. Yeah.
So you're not worried about having to treat artificial agents like psychiatrically. There's not going to be any psychiatry of AI in the near future.
Oh, so interesting. I mean, you know, there very well could be, in just the sense of if we create these agents that are capable of change, you know, like you basically they evolve, these AI systems that our input can affect how they evolve, let's say, you know, then maybe you have to, the way to go in and adjust one of these systems is not to go in physically with a, you know, screwdriver, but to actually feed it information verbally, which is kind of what, I mean, the other thing that's also interesting is that, and I talk about this a lot, because it's that we think we are so special or whatever because we have consciousness, but that's really only a tiny bit of what we have. And a lot of like the therapy I do with people is about, it's like behavioral therapy, or it's basically reprogramming people at an unconscious level. Like consciousness often doesn't even have much to do with it. So that's what I was sort of thinking, is that reprogramming you could also do with like a computer. Like it doesn't, many times you don't need the conscious part of it to affect behavioral change.
Right. So you may well have the best reprogramming may be some kind of coming into your office.
Talk there like this robot comes in. Like sit on my couch. And the thing I do
search engine is just feeling very neurotic lately, you know, it's like turning the wrong
keeps repeating the same thing over and over again. Exactly. We gotta like break the cycle. But I do think the one thing that, you know, I often think about, well, what makes us different from these things? Like if most of what we're doing is unconscious anyway, that's our decisions were being made and whatever. But I do think one of the distinguishing factors why maybe consciousness matters in humans and maybe AI systems don't have is like empathy, or you know, maybe wisdom, like certain, but empathy is a big one. And I once had this sort of debate, which was scary, with Larry Page, who was one of the co-founders of Google. So, you know, they're like running the world, right?
Yeah.
Like Sergey Brin and Larry Page founded Google. And so I gave a talk with another neuroscientist, Ed Boyden, who does fantastic work and is like one of the people who just helped discover optogenetics. And anyway, he's at MIT and does amazing work. And we gave this talk at Google on consciousness and the neural basis of consciousness. Larry Page came. It was a small like seminar, and then afterwards I got
the talks at Google thing.
It was they have this thing called Camp, which is we get invited for like a weekend, and but like scientists and tech people, and it's a lot of fun. And we all get to interact. And so we gave this little seminar, and Larry came, and afterwards I ended up talking with him, and he was just like, well, and he had said the same thing to me like 10 years prior, I remember. And I asked him, like, has anything changed in your thinking? And he said no. And so basically what he said is that consciousness doesn't matter. Because I was getting to this whole thing like, will this system, like Google, it's a very complex, like they have a lot of information, they're working on all AI stuff, will it ever be conscious? And he said, well, why? I don't care. Why would I care? And it was like, well, he's like, I just care that it's a really good like AI system, that it can do all the things that I wanted to do. Like, why do I care if it's conscious or not? I'm like, well, like sort of the argument, like, well, if your refrigerator, like you can kick it, and it's fine, but if it actually felt pain, subjective states, like that would be unethical, right? So right. Like I was giving these like examples of, so he's like, so what do you mean by this thing, consciousness? I don't understand. Like I was like, well, emotion. He's like, well, we could just compute, like that's a certain like, algorithm that we could just throw into the AI system. Like he was being very like, he was, and I was like, but the actual subjectiveness state, like the badness of the pain. And I went on and on like this, but he just kept saying, I just don't understand. I don't think, it was almost like a Dennett, like this doesn't exist, right? Like right. There is no such thing as consciousness. And so we could just program it in. And so like at some point we went on for a while, like back and forth, but at some point it was just like, okay, he just doesn't get it. He's like, I just don't think there's any such thing. There's no problem. We don't have to worry about it. We're just going to create this AI system, which for me felt very worrisome somehow. But empathy, really feeling with other people, because that changes our morality, that changes how we treat other things. And in all these sci-fi AI movies, it's always like there's this one, and stop me from going on a tangent, but I think there's this one called Transcendence, where
that's the worst movie ever, but yes, it's love that saves them, right?
Right, but wasn't that the AI one, or is that the one? Maybe I think or maybe it's the AI. The film is actually called AI, but where the big computer mastermind is like, I have to kill all humanity because I made a calculation, and it's like the most, like it's the best thing to do, like because humans are like the worst thing for. It's
like that's like iRobot, maybe.
Oh, maybe that's it, the iRobot one. Okay, yeah.
Yeah, Transcendence is the one where I think it's Johnny Depp uploads his brain into and then gets all the quantum computers, and he tries to take over the world too. But
yeah, they always try to take over the world. Like it always ends up not good. But like, if they make a very benign calculation, or like, well, I was programmed. I think they had all the, what's his name's, Asimov. Like,
Asimov, yeah.
And it was like, one of them was, whatever, it was like it was programmed to basically do the best things for humanity. And it turned out like the calculation was that humans are actually destructive and they're going to destroy everything there. So it's better to kill all of them. Like that was actually the most logical thing, right? Because that was just following the rules, but lack of empathy basically was the idea. So that concerns me, if these things can do very complex things, but if they don't have subjective states, particularly some sort of empathy or real emotion, they might end up doing amoral things, even though they think they're logically correct.
Yeah. I mean, I think that's a real problem that, so I think the person you were arguing with, I forgot his name already, but
Larry Page.
Larry Page. I think one of the things that he's saying is very important, which is that in a certain sense, it doesn't really matter whether these things have consciousness in the following sense, not in the moral sense, obviously I agree with you, but if they can act in the world and if they can form goals and devise plans for following out on carrying out those goals, then the question of whether they're aware or conscious is sort of moots, that they're agents, they're doing things and they can be dangerous. And so especially if they lack consciousness, and especially if that's important for like moral assessment, then we may be in deep trouble, which I think is kind of what your ultimate point you're getting at here is. Yeah. So if they can be intelligent but lack empathy, then woe betide us.
Then they're sociopaths, basically.
Yeah, basically, right?
That's the definition of a sociopath. But I mean, the other thing is that it affects is how we treat them, right? Right. Because if they say, wait, I don't want you to, like, if your computer says, I don't want you to shut me off right now, like I want to stay on and play this video game. If it doesn't have a subjective state, it's like, well, I don't care, I'm shutting you off. But what if you start to shut off and it says, ow, like that hurts, or I'm sad, and if so it does matter in some sense whether they actually have these states, because maybe the Roomba doesn't want to be your slave. Like maybe it doesn't want to clean your floor, and it has every right to say that, right? So that like how we treat them matters as well, whether they have consciousness or not.
It reminds me of did you ever watch The Good Place? I don't know if you saw that show, but
no, I never saw that.
It's a pretty decent show for like philosophy and ethical issues, but yeah, one of the beings in there is kind of like, I don't know if it's an AI exactly, but it's kind of like an AI, but it's programmed like whenever you go to shut it off, it's programmed to like plead for its life and say, no, don't do it, please. And it gets really, but it's all fake, there's no real, or I guess it's not clear in the show, but one assumes that there's no actual conscious experience there, but it's this like, that's its defense mechanism, because basically it knows humans can be manipulated in this way. And that's another real danger, is that we are easily manipulated in this way. And if they figure that out and don't share us, then of course they're a perfect sociopath. They can mimic these states. And I guess in another way, that's the plot of the, now I'm blanking on the name of that movie. What's the name of that movie?
What is it about?
It's about AI, and it's got the kind of googly character in it.
Ex Machina.
Yeah, Ex Machina, exactly.
Yeah.
So that, in a sense, that's sort of what the plot premise of that is that AI learned to manipulate the emotions of the person as a way of getting out, basically, just to go see that stoplight or whatever. Spoiler alert.
Right. The crosswalk. Yeah.
Yeah, exactly. Yeah. So that's a real danger, and I don't think we're prepared for these sorts of things at the level at which they're at the rate they're approaching us. I don't think we as a society are ready for this.
I fully agree. Yeah. We're just kind of like dilly-dallying along, like, oh, that thing can, do a cool trick for me, and not really thinking. I don't think most people are thinking about these like larger, big, philosophical or issues that are, I think in my mind, it would be very important if we could figure it out to give them for them to have conscious states. I think that would actually, although, again, you get into the whole nother like possible dystopia with, that like things like Blade Runner and whatever, where, they take over. But I just think that them having conscious states could maybe make them more humane and make us think more about how we're going to be treating them. Rather than the sort of psychopathic kind.
I mean, we already don't have very good track record treating other conscious agents very well.
Correct. This is correct. I mean, in some sense, maybe obviously it's like the natural evolution. Like maybe they'll just be better, things than we are, and we just kind of evolve out of the system.
Well, I was going to ask you about that, because I wonder what your feeling about transhumanism in general is. About what? So I know you're involved with deep brain stimulation, which is, right now it's only used for persons in dire straits, right? You don't get these things implanted unless you've resisted to medication and therapy, and they've tried everything. And this is like the only alternative instead of surgery, I guess, as far as I understand it. Yes. But the effects are amazing. I mean, I've seen you talk about one of these patients who just like lit up when you turned on the electrode, and this is for depression, right? But one sort of can see it's not too far of a bridge from there to doing it for, neurotypical persons who may have, low motivation or just want to be happier. I mean, why go to a rave and take ecstasy when you can have one of these things?
Yeah. So the cognitive enhancement and no, I definitely see us going there. We're definitely going to go in that direction, because that's what humans do. But I think that, sorry, there was a huge thing that just knocked on hopefully it wasn't a tree. We're in the middle of a storm right now, but yeah, okay, I think it's fine.
The AIs are angry, Heather.
I know.
It's Alexa.
It's like the AI gods. It came up from like the skylight. It was like this huge bang. Like, but no, I do think that we are going to evolve in that direction, and people are already starting to either do that or think about that. I mean, Elon Musk's whole like Neuralink or Neuralace, whatever, that's ultimately what he wants to do is use these to make them sort of thinner and more able to just kind of be enmeshed with the neurons and easy to, because right now you have to have neurosurgery. So this is the big like rate limiting step, is that it's, I mean, we call it like minimally invasive surgery, but you have to take a burr hole and like drill into the skull, and it's not there are some risks.
And you have to take like medication for the anti-epileptic medication. I always thought that once you like breach the skull, there was like a depressurization, or I don't know, something that.
Yeah, it depends. Well, we have not necessarily. Okay. Sometimes. I mean, like because we do like neural mapping, like sometimes with the patient who's coming in for to get like a tumor removed or something, and we have to make sure that they don't take out, let's say, like the language area of the brain. We will kind of slowly stimulate piece by piece and wake them up during surgery and have them talk. And sometimes they have little epileptic seizures when we do that, because you're actually inducing, you're giving them electrical stimulation directly to the cortex. But wow. But usually, you wake up a person during the surgery, you can talk to them, you can test out where the electrodes are implanted. But I think, the average person, maybe that's a bridge too far, right, to get the neurosurgery. But I
mean, especially Elon, he's like, here, put this in, you could check your email. It's like,
I'm gonna like risk, and yes, you could have seizures, you could have an infection, there are risks. Like, do you really want that? So you can just check your email in your head, which I don't even think you can do at this point. But, they will get smaller and smaller, and perhaps they will figure out a way where you can implant it. Maybe it's through, a vascular system or some other way. So let's say that we get to that step. I still think the other rate limiting factor is our understanding of the brain and how it works. Yeah. So like, even with the deep brain stimulation, we can only really treat things where we really know the specific circuit that's involved in the disorder, like certain movement disorders, like Parkinson's, or like with depression. It was we really studied that and understood that circuit, and then we intervened within that circuit. But other disorders, say for example, autism, where it involves like many sort of your brain is wired slightly differently, or genetic certain genetic or neurodegenerative diseases, there's no one place where you can intervene in a particular circuit that's going to affect that, let's say dementia or something. So the same way we're limited with, like, let's say, I don't know, intelligence in general. Like, where is intelligence in the brain? What's the intelligence circuitry? Like it's distributed, it's information distributed throughout the cortex. So where would you actually intervene? So I think we're only limited insofar as we understand the brain, or insofar as it's possible to intervene in a particular circuit. So I think things like maybe attention, we could probably, like wakefulness, we know it's the circuit. Working memory, like certain things, yes, where we understand the circuitry and we know where to intervene. But it'd be a lot of playing around, but we could probably hit a spot where maybe, yes, we can increase your working memory. We can increase your, wakefulness, like your attention, maybe like decrease your need for sleep, even though that has some negative consequences too. But so I do think there are certain things we can do to intervene. Maybe we can work to shut down your dorsolateral prefrontal cortex and like increase your creativity momentarily, or you can turn it on and off, right? Because we talk about like getting into these flow states, and the more we understand the neurocircuitry of that, like maybe we shut it down, the dorsolateral prefrontal cortex, you can be creative for an hour and then you turn it back up again, there's certain things we can maybe do. But then of course all the ethical questions, like who can afford those implants? They're going to have such an advantage over everyone else. Maybe nobody gets to have them, like performance enhancing drugs,
or even worse. So you can imagine, like, workers like in China in a sweatshop having their need for sleep reduced against their will or something like that, and working 20 hours a day. So you can imagine horrible abuses, as well as this 2-level society thing you're talking about as well.
Yeah, and also, by the way, I mean, a huge funder of this kind of research is DARPA, right, which is the Defense Department. And I've talked to people there working on stuff with implants with soldiers, like maybe they can be more accurate in targeting things like missiles, like if they can just skip the actual hand movement and just use it with their mind control, and so maybe we have these transhuman soldiers that are fighting our wars for us. I mean, there's definitely, with all of this, there's always going to be a nefarious purpose. I mean, it always starts out with like, we're developing this thing to like help people who are disabled, or to treat a disease, and then it starts to morph into whatever, people using it for their own purposes. So well, I think cognitive enhancement will be in certain domains will probably be possible. The question is, do we want to be able to do that? Just like the designer babies, like, do we want it? We can use CRISPR and start playing with the genome and creating superhumans, but is that something we really want to be doing? And there's laws against that. So I think it'll be in that realm of,
You don't envision like, I know you do work on like schizotypal personality disorder and, antisocial personality disorder. You don't ever see a day where we can intervene on those sorts of cases directly, do you? Or that's always going to be like a medication/therapy situation? Or
I think the personality disorders tend to be pervasive and they're really like lifelong. So even the treatments we have now, the medication and the therapy is just to mitigate the symptoms, but you don't fundamentally change the person's personality, borderline personality disorder or antisocial personality disorder. It's pretty much a lifelong thing where the symptoms might get a little bit better, but they never completely go away. Narcissistic personality disorder is another one. And that's one of those things where I don't think that there is a particular, like, we wouldn't even know where to intervene. I mean, maybe with certain ones, like, okay, let's say antisocial personality disorder, like, or psychopathy, maybe we can turn up their amygdala response so they have some more like emotional, or like we can intervene in the empathy circuit and try to maybe turn that up a bit and see if that helps. There's definitely things like, there would be interesting experiments we could do.
Right. But I thought some of your work was sort of showing that there's some commonalities between these kinds of diseases and sort of focusing on the prefrontal cortex as maybe, so you could intervene there possibly. I mean, given some of the things you've looked at.
Absolutely. Like, so I talked about where, like, for example, borderline personality disorder, which, I looked specifically at the impulse control or emotional dysregulation aspect of it. And it has to do with decreased activation in the orbital prefrontal cortex, which is kind of like our brake system. And that mostly, it tends to be more females are borderline. It's about 75% female, but so there can be men borderlines, but it's less common. But then that the male kind of version of that might be antisocial personality disorder, because the females, they tend to harm themselves. They're like aggressive to themselves, the self-harming. And whereas if you take that impulsive or emotional dysregulation and you harm others, then you get diagnosed as like antisocial, right? Because you're acting out, or like a conduct disorder. So depending on the behavioral manifestation of the symptoms, you might get diagnosed as one or the other, but fundamentally they both have dysfunction in the prefrontal cortex and the orbital prefrontal cortex. Anyway, if you intervene in there, perhaps, but again, with these implants, even now, we don't know exactly what they're doing. Are they knocking out a faulty circuit? Are they turning on, one that was turned off? Like, we are still not even quite clear exactly the mechanics of it. It's sort of like with ECT, you just sort of like did it and you knew it worked, and it was like, okay, it's like, you're just turning your computer off and on when something
exactly hard reboot.
Reboot, boom. Like, I don't know what it did. I don't know the specific mechanism, but something happened. And so that's this is like a more targeted ECT that's constantly on. But so we know a lot more about it than just the more generalized ECT, but it's still, there's a lot we don't know. And so
this is like the horse and buggy stage that we're at. We're not even at the point where we really know what we're doing. But one can imagine, I mean, if we could target the kind of electrical activity to mimic the kind of patterns that you would find. So if, like, for instance, prefrontal cortex, if it's diminished activity there in these kind of psychopathic pieces and stuff, then one can imagine one could just kind of amp up that activity or somehow give it a boost up, and you should see something going on. I know there's some sort of, stuff out there that suggests that.
Or training it, like kind of training the neurocircuits to, like, whenever they see, let's say, like a scene that's like, I don't know, a crying baby, or like a death scene or whatever, something they should feel empathy for, that like you activate those circuits, and then over time, maybe they learn how to respond. There might be some of that kind of being used for learning, and to kind of rewire the brain somehow. Yeah.
It's interesting. Yeah, that's a good point. A kind of internal modeling of the right response.
Yes. Yeah, pretty much. And then you like, maybe like add in a little hit of dopamine, like for reward. Exactly. So you just like simultaneously like dopamine, like hit the nucleus accumbens while you hit the empathy circuit, so they learn to like enjoy the empathy. something, I'm sure we'll try it in animals first. That sounds horrible.
Yeah.
I don't do any animal research, but we'll have to do some experiments first before we get to that point.
Yeah, I know. I had to work with animals when I was in grad school, and I didn't enjoy it. But it's rough, but important.
Yeah.
But it's so. I wanted to. This kind of segues to the next thing I want to ask you about, and I realize you have to go in about 15, 20 minutes, so I don't want to keep get to this before we leave. But so you work a lot, not only on the aspects of consciousness, but unconsciousness. And one of the things that I was kind of surprised at when I was looking into your stuff was I knew about the cognitive unconscious, but the kind of Freudian unconscious, which I guess I didn't realize was as respectable as you make it out to be. I sort of thought that it was that repression in particular, I thought was kind of an idea that hadn't been verified. But you give some interesting reasons for thinking that it is important and part of our thinking about the mind. So I wonder if you could tell us a little bit about that notion of the unconscious, how it's different from the other one, and why we should keep it around.
Yeah. So the kind of, let's call it like the cold unconscious, the cognitive unconscious is that, more or less is like whether you see it or you don't, like these experiments where like you present a stimuli and then you ask the person, like, did you see it or not? And maybe they didn't, they said they didn't, but it still got in there and affected their, then they're primed for let's say the next test you give them, right? So some of the information did get in outside of awareness, they processed it in some way, and it goes on to affect their behavior. But it's not a sort of deep emotive unconscious, the kind of unconscious that Freud was talking about, this dynamic unconscious. And I was really interested in that. And so, but I came at it very objectively. Like, I don't, there's some people who are like Freudian, like I was, involved a bit in that psychoanalytic world, like, and they are, some people are like, it's almost like gospel, like Freud's word is gospel. Like they cite Freud, like according to Freud, like section, blah, 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 he said, and it's like the word of God. So, I'm not one of those kinds of people. I was very agnostic, let's say, to Freud. I'm a Freudian agnostic. But I said, let me go through the neuroscience research, like do kind of a lit review and look for studies that didn't necessarily set out to like prove or disprove a psychoanalytic concept, but that inherently might have given us some information about that. And so that's kind of how I went about it. I was just like, I'm going to look purely at the data and see if any of this data makes sense as it relates to psychoanalytic concepts. And what I found is that, there is some evidence for these defense mechanisms that Freud talked about, things like dissociation and suppression and repression. Repression is harder to measure because it happens automatically, so you can't really set it up in a lab. So you have to be very creative in how people kind of look at those things. But and
suppression is the conscious,
is the conscious pushing away of something that's like, let's say, emotionally disturbing. Like, oh, I had a fight with my significant other today, but I need to work. I'm gonna like not think about that now and suppress it. Whereas repression kind of happens automatically. You have some sort of trauma and then it automatically gets relegated to the unconscious without you kind of being aware of that process.
I thought like the notion of like a flashbulb memory was kind of evidence against that. So that when you have trauma, it usually is not like something that gets repressed. It's something that you can't escape. And
it depends, it depends on the trauma and it depends on how it was encoded in the first place. So I do think, when we talk about repression, it's kind of like, it doesn't have to be some major, like, you were raped and it was a big or whatever, very, very traumatic. Because if you think about it, our brain is taking in information. If it's an information processing machine, it's taking in information all the time, all day long. But most of that information is, you don't really need to retain it, But some of it, if it's, let's say, emotionally salient or particularly meaningful for you, the brain will say, maybe I'm going to hold on to that. But you don't necessarily have to be conscious of it, And sometimes it's just held on to because it is maybe anxiety provoking, that you have mechanisms that it's adaptive to prevent that information from bubbling up all the time, because that would be maladaptive. And that's where you see these flashbulb memories or like people with PTSD where they can't stop the intrusive thoughts. So, they're, not all trauma affects people the same way, and people have different defense mechanisms depending on how their brain works and depending on their personality type.
Right.
So
Okay.
like certain people, like I tend to use my go-to defense mechanism is intellectualization. Like I will like, try to like read all about the issue and think about, like that's my way to kind of distance myself from it. Other people have different things like projection. So, but evidence suggests that there are these neural mechanisms that can overlap with something that we might call repression, definitely, suppression. That I don't think Freud had it all wrong. I don't think he was all right either. But I
Yeah,
do
he was a
think
weird guy, that's for
he
sure.
was a strange guy. Yeah. And it was
Yeah.
fueled by a lot of like cocaine and stuff.
Yeah.
But listen, like for the time he lived in, he really was pretty insightful in,
Yeah.
a lot of things, and shifted the perspective of like what it means, to have a psychological illness and how to treat it. And I think it was really important for that. But he got something, I mean, some things were far out, like a lot of things were far out, but there were certain things that I do think he had right. And some of the defense mechanisms and the way he thought about the unconscious, I think some of it was spot on, at least according to neuroscience backing a lot of it.
So yeah, because I thought it was interesting. One of the, studies that I knew about independently of this, but then hadn't thought about it in the way that you presented it, was this one where they presented subliminal images of nudes to people, right? And so they present the nude female to the heterosexual male, and it's like the attention is drawn there. But there are some cases where they present the nude male, and the attention is like repelled from that
Diverted.
side of the street. Yeah, it's diverted. And I hadn't realized, I took that as evidence that there's unconscious perception, because they were categorizing it in terms of like whether it's male or female. But you were argued that this actually kind of evidence for the idea of repression. Is that right?
Yeah. The idea of like in that case, it's so the images were presented unconsciously. Everything was presented unconsciously, and then they did a test to see where their attention was and if it was looking at the image or not. And so the heterosexual men, right, their attention went towards the females. Heterosexual women, their attention, unconscious attention, say, went towards the males.
Basically they knew that because afterwards they put something there and they were slower to name it or quicker to look at it, or right?
It was like a little Gabor, like a patch of like stripes that was either like directed and like tilted one way or the other, and you had to say which way it was tilted. And if you were already attending to that area, then you were more quick to say which way that little patch was tilted. So it was looking at just your visual in the visual domain. But homosexual women, this was interesting, paid more attention to, because they present a male and a female at the same time. So homosexual women paid more attention to and they were naked, right? So they paid more attention to the naked woman. But heterosexual male paid more attention to the naked women as well. But when there was a naked man, they paid less attention. They diverted their attention unconsciously away. And the idea that I suggest is that it might be that they have that produces anxiety in them, this idea like a naked man, and that they, need to repress, so to speak, and kind of look away or keep it out of awareness. So it's obviously it's again hard to get to these processes, but I thought that was an interesting study that might begin to get there. So, and theoretically, like if there's a lot of evidence to show that suppression exists, that you can push something out of your mind. And if there is a mechanism for that, it's not that huge of a stretch to say, well, that process can also occur outside of awareness as well.
Right. I guess it's not exactly Freud's notion of repression. Because first of all, he thought that the kinds of things that were being repressed were these really weird, like, desires for, sex with your mother or with your dad or weird stuff like that. But so, and also, so this looks like what you're suggesting is that there's something that they're have anxiety about, so that the mind kind of keeps it away from your conscious mind. So these people may be having latent homosexual desire or something and not even really consciously be aware of it. That's kind of the idea.
Yes. Yeah, pretty much.
Yeah.
It would be interesting. I would love to do a follow-up study, which they obviously didn't do in this study, because this was just really looking at like unconscious attention. They weren't looking at Freudian things. That wasn't their intent. But I would love to follow up and give those people questionnaires about, how how, let's say, homophobic they are.
Right.
I would predict that the more homophobic people are the ones who had their attention diverted away the most, basically. I would suspect there would be a correlation there.
Yeah, that's interesting. Yeah, and that was first put a new light on that whole concept, because I thought like things like reaction formation, I thought that was something we thought was like legitimate. That you have this that might explain why you become homophobic, because you have this you react towards the opposite to sort of deal with the fact that you have these kinds of things. But the idea that there's something in there patrolling, so to speak, and keeping these things out of your conscious mind, that's a little bit disturbing, I guess. But it was interesting to see this evidence, because I hadn't thought about that in that way before. So I thought that was really interesting.
Well, the other interesting thing is just like, why would it be that these processes only occur at the conscious level and not at the unconscious level, right? Like, when so little of what we do happens at the conscious level, most of it's happening unconsciously. So if some things that seep up into consciousness, then those are the things that are probably the most likely to also have an unconscious correlate. Because they are probably happening all the time under the surface, and occasionally it pops up, and most of the time it's happening under the surface. It's a higher probability. Like let's say biases, like unconscious biases and things that are normally we're not even aware of them, but we can pick them out when we give people certain tests, like an implicit association test. But we're normally not even consciously aware of it. So I don't think consciousness is the end all and be all. I think most of it's unconscious, and occasionally we get conscious access to these processes.
Occasionally, when we let our guard down.
Exactly. Usually it's just the conscious is like this ego, the protector, it only tells us like a few of the things that we can handle. Yeah. Sorry, go on.
That's okay. The things that are unconscious on the way you understand them, do they have a phenomenal aspect to them? Or so I'm wondering what your feeling is about like people like Ned Block and his overflow argument, where they say these things you cannot be aware of them, but they still feel like something from your point of view. There's still a subjective aspect you're just not aware of. I wonder what your take on that is.
Yeah, I've had I debated. I think it was Jaak Panksepp. On this, actually, at the New York Psychoanalytic Institute. It was he and Mark Soames against me.
Oh, okay.
And I won the debate. Thank you very much. I had neuroscience on my side. But what they were arguing too is that, and Jaak in particular, was that there is these unconscious emotions, feelings, but in a way, and I just didn't. That in my mind is counterintuitive, because the definition is that as soon as there is a certain feeling, whatever, then that automatically it is conscious. So this might be like a kind of philosophical, like splitting hairs thing, but I think that inherently, like, I don't think you can have unconscious feelings, if that makes sense.
Right.
The second you feel any inclination of anything, then it is conscious. Like an intuition, a gut feeling, whatever that is. Like the second you actually are aware of that feeling, then it's not unconscious anymore. I don't know is that answering the question?
Yeah, no, it is, because I mean, one way to get at this is when you talk about subliminal face perception. You show people like threatening faces versus smiling faces. Excuse me. They say they don't see the faces. But then you can sort of show that their, heart rate is increased, or their galvanic. They're liable to judge something afterwards as threatening or distasteful. They don't like it for some reason. If you show them a mean face, they like it better if you show them a happy face. So these are all presented unconsciously, though. And so some people, like the Jaak Panskepes of the world, want to say, well, you felt the fear, you just didn't know it. And then there are other people who want to say, no, you didn't feel the fear. You just represented that there was a threat, but it didn't feel like there was fear there. You sound like you're saying the second one, but I'm not sure.
Yeah, I think, I've noticed this too. Like because I was once going to try to do these studies with looking at, like binocular rivalry, and how, let's say you can put an angry face in one eye and a neutral face in the other, and you can't see both at the same time. So people will tend to see the angry face and it'll supersede the neutral face. But that the idea is that people who tend to suppress or dissociate might actually, they might spend less time on the angry face because they're pushing it outside of awareness, and
interesting.
automatically just keep the neutral face in awareness. But looking at them, they do have a physiologic reaction to the faces, even though they say they don't feel any reaction. Like
Right.
somebody also like with dissociative identity disorder is really interesting. These are people who can go into these different identity states. Used to be called multiple personality disorder. But in one state, they say they have no access to this traumatic memory happening to them, and they actually don't have the physiologic reaction to it. And in another state, they say that did happen to me, and they do have the physiologic reaction. So that's an interesting separate case. But in certain people where they say they don't see it and they get some, let's say, increase in physiologic responses, they could be having unconscious, reactions to things like we all have. And that could be affecting their behavior. But I still think it's happening outside of awareness. I don't think it's, unless they notice the feelings and become
Right.
aware of them. Yeah.
So you would say
It's
that there's nothing that it's like for them. There's no phenomenal aspect as long as it's outside of awareness.
Right. And as soon as it is like something or it feels like something, then it's no longer outside of awareness. But I do think those signals, like Larry Page was saying, like, oh, we can just program the emotions in. I think that's probably likely what it is when we have these unconscious quote unquote emotions. It's just information that's pushing us in one way or another, but we don't have subjective states about those responses.
Cool. Yeah, we agree a lot on this area. So that's awesome. I like it when I find people that think about these issues in the same way. I want to ask you really quickly about DID because I know I read about a really interesting case about a woman. I think it was a woman who was like, one of her alters was blind.
Oh,
and
yeah.
when they put her in the fMRI, she didn't have like visual activity in the cortex. And then when she could see, it was. So I'm wondering, first of all, so you think this is are there really two streams of consciousness in that brain? And then secondly, I wonder, do we know what happens to the other one when one of the alters are they unconscious in the sense we're talking about, or are they still hanging around somewhere?
Yeah. So that actually blind case was an interesting case I came upon. It was a case study that was done in Germany, and it wasn't even, the article was not in English, just the abstract was. So I sent it to my colleague Christoph Koch, who's a well-known consciousness researcher, and asked him to translate it because he speaks German. And so then we actually incorporated into a piece we wrote together for Scientific American. But it was fascinating because, I mean, basically, when she was in this blind state where she said she couldn't see, they did a EEG over her visual cortex and gave her this like flashing checkerboard image, and her primary visual cortex did not respond to that. So that's like keeping your eyes open and trying not to see, like not having actual activation of primary visual cortex. Very difficult, which means that the suppression of the information has to be coming at a place higher up in the chain, perhaps even at the thalamus, so information first comes through your retina, goes to the thalamus, and then it goes to the cortex. So maybe somewhere in that chain before it even gets to the cortex, it's being suppressed, which is an amazing automatic, if that really is happening in the brain, like how it's happening. So what they're doing is then we wanted to test her, but they reintegrated her personalities per se, and she lost that. She got better, so I couldn't get her. But no, I do think that we can be in different brain states. I don't think it's that you're necessarily, it used to be called multiple personality disorder because they thought they were like different personalities, different people. It's not so much that. Now it's called dissociative identity disorder because the idea is that you have one identity that's been fragmented. And the whole idea of therapy is to bring these pieces back into one whole cohesive person, let's say, or memory. Like basically what it is a fragmentation of certain memories that you only have access to in one brain state versus another. It's not so much a whole personality per se, but I would say a different brain state. And so there is somewhere in the brain a switch that can kind of push us in one state or the other. The other thing we find with this is that when they are in the neutral identity state, so usually there's a traumatic identity state where they do have access to the trauma, and the neutral identity state where they don't. And that actually takes more brain activation. They have more prefrontal cortex activation because you need that in order to suppress the memories.
Interesting.
But I do think you can be in these different brain states. And sometimes in some cases, in one state, they have allergic reactions to certain things. In another state, they don't. I mean, it really gets at these very basic, like physiologic responses. So there's still a lot about the brain we don't understand, we don't know. And we have to look at both the human phenomena, like when we see things occurring, and then, try to understand it. We used to not even believe that that was a real disorder, but now that we're seeing the neural underpinnings, we see there is really differences in the way their brain is working. So I think we need to, believe the clinical phenomena.
If you would say that it's not two personalities, is it two streams of consciousness though? Or is it, again, just one stream of consciousness that's fragmented? Or how do we, in terms of consciousness, how do we talk about it?
Yeah, I would say they're the same brain and the same consciousness, let's say. I wouldn't say they're two different streams of consciousness. I just would say that it is, you know what a good analogy is? It's like if you're running like you have a Mac and you're running Windows on your Mac.
A Hackintosh.
Yeah. Yeah. It's like the same operating system. Right. But sometimes you're in like one state and you're operating in one way, and then you're in another state and you're operating another way. It's still you, but in one state you only have access. Because actually, I'm working on this book now. It's about impulse control. It's going to be due out probably later next year in 2021 or early 2022. But so it's still in the early stages. But one thing I'm working on is the idea of self-control and what is the self, and there really is no self, and the self is a construct of the brain, and it's a lot of it is based on a narrative, on our memories. And so if you're in one brain state and you only have access to certain memories, you're, in a sense, you are a certain identity, right? You are a certain person, because we construct this narrative. It's made up by our brain. So in one state we have certain memories and we're a certain person in our narrative, and in another state we have different memories and we're a different person. So I don't know if I'd call them two streams of consciousness, but I'd call them two brain states that have access to different content of consciousness and therefore create different narratives.
Yeah, interesting. All right, well, I see we're getting on time here. I know you have like a real job you actually have to do, so I'm gonna have to let you go.
And real patients coming up next, right after this. Now I'm really good and primed to treat them. Yeah.
Yeah, exactly. Don't let them watch this until after. But
exactly.
Well, hopefully someday when that book is finished, maybe you'll come back and we can talk about the book, because it sounds really interesting.
I would love that. Yeah, I would love to come back on, and closer to the actual publishing date, and then we can have a whole conversation about that. Yeah,
absolutely. Okay, cool. Well, just as a final question, then, I wonder if there is anything that we were hoping would come up, but that hasn't, and the answer can be no, but just checking.
Oh, that's a good question. Well, I don't know if I was hoping, but a whole new field. This is like for a to be continued. This will be part 2. But something that I'm really excited about now in the realm of psychiatry is the use of psychedelics for treatment. So psychedelic assisted psychotherapy. I think it's really cool. It's like where psychiatry is moving towards, like ketamine for depression, MDMA for PTSD, psilocybin for anxiety and end of life issues. There's just really cool work happening in that area right now. And I think it's a really burgeoning field, and psychiatry is going to shift in that direction, because in the last 50 years, we haven't really made any major breakthroughs, a couple of little things, but I think this is kind of the way things are going. So I'm really excited about that whole area of research and potential for treatment, and really having a big impact on people who've been suffering.
Awesome. Yeah, actually, I'm going to be talking with someone on Monday, a philosopher who's working on the philosophical issues related to this exact called philosophy of psychedelics.
Oh, I'd love
psychedelic therapy and all of that kind of stuff. So this is something I'm also very excited about. It's cool to see that this is getting some recognition, because for a long time these drugs have been maligned, but actually they're quite useful if used correctly.
Exactly.
So I think
the stigma
really
is breaking and it's becoming mainstream. Even Mount Sinai, where I'm at, they're starting to develop a whole center that's going to be dedicated towards that. So it's really becoming more legit again.
Yeah, that's good. It's not like, we're not saying go and trip in the woods and you'll be a better person. It's really targeted and under guidance of a therapist. And
exactly. It's a controlled situation. It's not like you just go to the club and then you're going to be like healed. It's,
exactly. No, I was reading a lot of these. It's like IV, they give them intravenous psilocybin. I was like, well, that sounds scary to me.
Intravenous ketamine. I have patients who've done it and it's been phenomenal. So it's amazing, but it's a controlled environment and very specific dosing and guided and all the rest. So
cool. Well, definitely we'll have to come back and talk about that at some point, but I don't want to make you late. So let's go ahead and let me thank you for joining me today. It was a wonderful discussion, and just hang around for a second. I'll say bye off the air.
Okay. Thanks for having me.
Okay, we're clear.